Welcome to Premier Dermatology. I'm Dr. Missy Clifton. I'm here today with our lovely patient, Sherry. We're going to be doing a couple of procedures on her upper arms. We're going to be doing the body tight procedure, and then we're going to be doing the Morpheus procedure. Both of these are radio frequency energy. The body tight will be a cannula that actually will go underneath the skin. So a little spoiler alert, we will be entering the skin with this little cannula. It's blunt, it's not sharp. She's already been completely numbed, so she's gonna feel really comfortable. It's not gonna be painful. Once that cannula is in place, we are gonna heat the fat tissue and the subcutaneous tissue. In order to do that, we are going to use this cannula, moving it back and forth. Once we reach that goal temperature, then we will move to any other areas that we want to treat with that device. Once that part is done, we will do the Morpheus, will be the next segment. The Morpheus is radio frequency microneedling. So it's kind of like regular microneedling devices that go into the skin with little prongs, but what's special about it is it actually delivers radio frequency heat once those prongs enter the skin. And it can deliver heat at several levels. It can go all the way down to 5 millimeters in depth, all the way up to the very surface 1 millimeter in depth. So you can actually get really uniform heating of the entire dermis and then into the epidermis. So not only are you getting melting of the fat, you're also getting tightening of the skin. So this area, a lot of us hate. Sherry is not thrilled with her area here. She's a very fit, beautiful lady, but this part she's not in love with. So we're going to be doing the body tight through this area to try to melt as much fat as we can. And then we're going to be doing the Morpheus on the whole area. We're also going to do the same thing on the back of her arm, but I'll be mostly showing you guys the front portion today. All right, Miss Sherry, we are going to actually go ahead with the treatment. If you have any discomfort at all at any time, you just let me know. Okay, sweetie? You're just going to mostly feel some pressure here. So this is the body tight handpiece. It's really neat because this shoots energy and communicates back and forth to this little tip of the cannula. So we'll be moving this back and forth underneath the skin to get uniform heating down deep and then also on the surface. So here we go. We're going to go right in here. Lots of pressure. How you doing?
Fine.
Good. Erin, my nurse, she's lovely. She's my great assistant. I don't even have to speak. She just does everything for me. All right, so we're going to go, and you can actually see the machine as we go, and you'll hear a series of beeps. It's pretty loud. When we get to a place where it goes ding, 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 that means we've hit the magic number where we've gotten both the internal and the external temperature at the right place. You may not be able to hear that, but Sherry probably did. It almost sounds like popcorn crackling, and that is the heat energy being delivered into the fat tissue there. And it almost makes a popping sound because it's melting the fat. So when we hear that, we're excited. It means it's working well. We've reached our internal temperature of 70 already, and we're gradually getting that external temperature up, and there it is. That noise where it kind of hits that. That's the magic. So we know once we consistently hear that all the way across the area that the treatment in this area is complete. So that's going to be 1.2 kilojoules on the superior portion, Erin. All right. So again, this is the body tight handpiece. We use this to put energy underneath the skin and deliver energy back and forth throughout the skin and the surface. So we're actually melting fat and also heating up collagen as well. We're trying to get the internal temperature to a level of 70 degrees Celsius. We're trying to get the external temperature to a level of 40 degrees Celsius. And once we reach that, we hear that magical dinging where it goes really fast and we know we've reached that temperature. So you don't even have to look at the screen once you get used to it to do this device. So now we've done the top portion. I'm actually going to come from underneath and do this lower portion as well. All right, I'm going to take a little 18 gauge. I just use a little needle to make just a little poke so that we can easily insert this little cannula. It goes right underneath the skin. And lots of gel just to make sure that energy transfers well and doesn't cause too much heating of the surface of the skin. And then we go again. All right, so here we go. There's more of that little crackling and popping. We like that because it means the fat's melting. There it goes. And now we're at 70 internal temperature there. Kind of goes back and forth as we move the cannula, but we want it uniformly 70 all the way across. Yay. Okay, now we're going to go a little faster, and we're going to get that surface temperature up to 40. Because that level is where we've really seen the most optimal results. Sounds like we hit the slot machine. Perfect. So that is all there is to it with the body type procedure. So now we're going to clean off, we're going to switch gears, and I'm going to show you how the Morpheus procedure works. Now we're going to do the Morpheus portion of the treatment. This is our Morpheus 8 handpiece. This is radiofrequency microneedling, and you can see that that's the piece that actually touches the skin. And I'm going to turn my settings on so you can actually see what the device does. To start, we're going to go at a depth of 4 millimeters because that's going to hit that fat tissue again. It's going to go really down deep. It'll actually send the energy all the way down to 5 millimeters. The prong itself is 4 millimeters, okay? And we're going to go to a really good energy of 50. Cycle. All right, now, so I'm going to let you zoom into the handpiece here so that as I trigger the laser, you can actually see the little microneedles come out, and those will go into the skin when we apply it to the skin. It's going to make a strange sound when we do that because the laser is not in contact with the skin right now. All right, so we're going to get started. I'm going to start right over here. Very good. We've already cleaned off all the gel, re-prepped her skin with alcohol because we don't want any of that gel to be on the surface for this particular procedure. So with this procedure, I do double pulsing. Every time I put the handpiece onto the skin, I hit it twice, and I do 50% overlap. And we're going to do 2 passes at every depth. And right now, we're at that 4 millimeter depth. So Accutide and Morpheus, when the procedures are done together, we call it Embrace. And it's basically just delivering lots of radiofrequency energy all the way through the skin to melt fat and to tighten the skin. So now we're going to actually change our settings, and we're going to go to the 3 millimeter. And then we're going to repeat the exact same process with the 3 millimeter depth. So it's just not going to go quite as deep. So we're going to be in the dermis right now, so that'll tighten up a lot of the collagen. This is great for crepiness of the skin. It's great for skin laxity. And like we said, it's going to, at that deeper level, it's going to actually help to melt the fat as well. So we're going to start on this pass. Let us know if there's any questions. You doing okay? Mm-hmm. Good job. So after this procedure, she will be very swollen in this area. We actually filled this area with a lot of very dilute lidocaine solution called tumescent anesthetic. And it makes it very comfortable for the procedure, but it actually does cause some swelling just from the infiltration of that. The actual treatment itself, you can see some bruising, can definitely see some swelling just from the treatment itself. And you may feel just a little bit of almost numbness in the area because the little nerve endings that are around the fat lobules and in the dermis that we're treating can kind of get irritated from the energy. And so it can make it feel kind of tingly or numb at times. Sometimes as the fat is getting broken down, you can actually even feel some nodules underneath the skin because this heats that fat and then the body breaks the fat down and takes it away. What's also happening is that the body is stimulating now the fibroblasts to respond to the damage to the collagen, and the fibroblasts rebuild the collagen to support the structure of the skin. We do like for you to wear compression garments on this, so we'll wrap your arms for you and give you a garment that you can wear as much as you can for the first at least 72 hours. And that will help to push some fluid out, but it'll also help that skin to really contract as well. Then we will bring you back in 1 month, and we'll do the second Morpheus treatment. We only do the body tight treatment once. Then we will be finished with both treatments, and we usually get you back at about 6 to 8 weeks from that final treatment, and we'll take after pictures and be excited about our results. So I wanted to give you a few more details about this platform, this device. There's 2 different treatment modalities on the Embrace platform. The first one is Morpheus, which is the radiofrequency microneedling, and the second is the AccuTite or face tight or body tight, depending on where you are using the device. It's called different things. The fascinating thing about the combination of these treatments is that they can be used to eliminate tiny areas of unwanted fat by using the AccuTite, face tight, or body tight handpiece first in the areas such as under the eye where there's extra fat, under the chin where there's extra fat, on the back of the arms as we showed in our treatment today. You can use it on thighs, you can use it above the knees for the extra little bulge there, you can use it inner thighs, you can use it on the abdomen as well. And then once you do that treatment to eliminate the unwanted fat, you come back with the Morpheus handpiece and do the radiofrequency microneedling treatment. You do it at 4 millimeters, at 3 millimeters, at 2 millimeters. Sometimes we can even go more superficial. If a person has acne scars or superficial scar from a surgery or something that we really want to smooth in and improve texture, or if they just have really enlarged pores, we can go very superficial with the Morpheus treatment alone and get very nice smoothing of the skin. This device is wonderful for getting overall tightening of the skin, really anywhere you treat, but we've gotten fantastic results on the face, fantastic results on the neck. We can actually see tremendous tightening of the skin with a couple of the Morpheus treatments even alone. So the face tight, body tight, AccuTite do not have to be used in conjunction with Morpheus. You can just use the Morpheus device alone. And we do that in some cases, especially for people that don't have a lot of fat in the areas that we're treating. We usually recommend 2 treatments with the Morpheus, and usually we do those at least 4 weeks apart. Most people do beautifully with this treatment. You will have some swelling just from the numbing that we do, and then you'll have some swelling and some redness from the treatment. In the area where we do the AccuTite or Morpheus, that swelling is going to last a bit longer, and you can sometimes even feel little nodules under the skin where the fat is being broken down initially. Really not much in the way of true downtime though. You can actually put your makeup back on after 3 days if you want to. I like to do 3 days just to be super safe. We give you a post-care kit that has everything you could possibly need for those few days that you're going to be needing to treat your skin, and after a week you can go back to your normal regimen. So when we do body procedures, part of the post-care that comes along with the package, completely free of charge, is our Revision Body Firm. And this is a wonderful cream that you use immediately after the treatment. The Revision Body Firm actually has several key ingredients that make it so special. The first one is THD ascorbate, which is a very high potency, very stable form of vitamin C. So it's a powerful antioxidant. It helps to reverse and prevent damage of the skin. It also has peptides that go into the skin to help firm the skin, help your body to actually eliminate fat cells from the area as well. It also has botanicals that can brighten the skin, and it also has microbiome technology that actually feeds your good bacteria on your skin and allows them to do their best to help your skin renew itself.